I'm sitting on my bed, and I say, oh, a phone notification pops in. There's something, I bet you they found nothing. Sure enough, I pull it up, and I just see like these big, all caps, like hypervascular, irregular bladder mass. The radiologist is often never going to tell you it's cancer, but they said it's cancer without saying it's cancer. And I mean, that was just an absolute shock. I'm just start shaking because I'm like, this is cancer. There's no way it's not. I was diagnosed when I was 21 years old, so I was in the middle. 4-year undergraduate program studying chemical engineering. My symptoms, which I didn't know at the time when they began, started probably about 18 months before I was finally diagnosed. I was in my sophomore year, and one night I went to use the restroom, and I noticed, the toilet, it was red. That night I had eaten, I think I had carrots with my meal, and I was like, oh, it must have been something I ate. There's no way this is blood. I didn't have any pain or anything, never had issues before. It was just there. So it was late at night. I think it was 11 p.m. And I said, and I don't feel like it's an emergency. I'm not going to go to the ER. If I see it again in the morning, I'll do something. Morning came, and, I didn't see anything. It was completely normal. And it was normal for another month or two, or even 3. And then, after a good bit of time, it showed up again. I was just like, oh, maybe it was something I ate again this time. Maybe it was beets or something. I like my vegetables. I like my fruits. They have all these dyes in them. They say those can affect the color of your urine sometimes. It took me a while to put 2 and 2 together. Eventually that started becoming more frequent. I would say at some point I realized, no, this is not something I'm eating. This is blood. I'm kind of shocked at myself looking back at it because I made that realization, but for the longest time I didn't do anything about it. I was so busy with my coursework. I was doing engineering. I was doing pre-med because I wanted to become a doctor. I had all these things going on, all the problems that a college student's going to have figuring themselves out, that I kind of triaged it. I put it to the back of my mind. My personal health was kind of, it wasn't a priority. I was too busy to have this problem. And I ignored it, never had any pain or anything. And then eventually one day, I finally kind of got hit with it because I started seeing clots too. And that's when I made the realization, whatever's going on, it was getting worse. It must be getting worse. And that's finally when, I was living in an off-campus apartment, with some roommates. I called my mother and I was like, hey, can we get me into the doctor, the family medicine doctor? She's like, no, you need to go see the urgent care. That was a great call on her part. She's like, you're not delaying this. We're getting this solved tonight. We're gonna figure out what this is. So I go to the urgent care one night. It's like 6 p.m. and they close at 8. And I'm one of the later people they see. They got people who are in much more urgent than me. Oh, you just got this young guy who's he says he has a little bit of blood in his urine. They do the urine analysis. Yes, there's blood. They do a blood draw. All those labs are normal. My kidneys look fine, liver looks fine. And the urgent care doctor, he seemed really puzzled. You don't very often see a young man with blood in his urine with no other symptoms. Usually you would have some pain. It could be like a UTI or something caused by like a kidney stone or something, but not something like this where it's just there and there's just no other symptoms. He was really diligent, and I'm really thankful for him because he ordered an ultrasound. I think it's really easy to dismiss me, just give me antibiotics. Oh, it's probably just a UTI. But no, he ordered that ultrasound. So 3 days later, get that ultrasound, and everything's normal. There's me and the ultrasound tech there. She ultrasounds my bladder, and then she ultrasounds my kidney, and then she ultrasounds my bladder again. And I didn't catch that at the time. Yeah, she probably was shocked. Like I see a bladder mass in this guy who's in his early 20s who no risk factors. I didn't have any genetic things. I drank clean water. I hadn't done any risky thing that would say, he could get this. I didn't realize it till after his diagnosis. Oh, that's why she checked it twice. I go after that appointment because that appointment was after class. I'm doing all these classes and stuff during this time. I go get my lunch at like 3:30 because I was so busy that morning. I go get Taco Bell. I come home. I'm sitting on my bed, and then I say, "Oh, a phone notification pops in. There's something. I bet you they found nothing. I had absolutely no expectation that there was going to be something that said anything like cancer on that. And sure enough, I pull it up, and I just see like these big, all caps, like hypervascular, irregular bladder mass. And I'm like, well, I don't have to be a rocket scientist to say that probably means they think it's cancer. Radiologist is often never going to tell you it's cancer, but they said it's cancer without saying it's cancer. And I mean, that was just an absolute shock. I'm sitting on my bed thinking, this is just a nothing burger. Nobody's around me. I just pulled this up. The doctors hadn't reviewed it yet. I'm just start shaking because I'm like, this is cancer. There's no way it's not. Sitting there, with this like pink marker, just like my hand is shaking, trying to write the details of this and like, what I need to do. And I call the urology office I was referred to even before I got the ultrasound results. The urgent care doctor, he referred me. I call them and they're like, we haven't seen the results yet, but if you're saying there's a mass there, you need to get a CT or we're not going to see you for another year. I'm like, well, we're not waiting a year. That's not something you can do in cancer. I need that CT. I need it now. I'm done. I've been pushing this off my whole life. I'm not going to be a day late at this point. No, that was my mindset. Like we're solving this as soon as we can. So I volunteered in an ER at the time, and I knew you could do this. So I went to an ER and I said, I have a bladder mass. I need a CT scan before they'll see me. And they saw me. They got me that CT scan. They loaded me up with water. They got to make the bladder look real big. And, I was having a really hard time in that machine. You never had to pee so bad in my life. And the tech had to do a little bit of cleaning after that. But we got the scan. And sure enough, it confirms the bladder mass. And the ER doc calls the urologist on call and says, hey, we got this young guy here, 21 years old. He's got what's probably bladder cancer. Can you see him tomorrow morning? And he goes, yeah. He was semi-retired. I was really lucky. I got to see him first thing the next morning. And he goes in. We go in there. He's like, look, you got bladder cancer. It's probably low grade. It's super uncommon to see in young people, but it's probably something we just cut out, and it's not going to be a problem again. So he says, luckily for us, the orthopedic surgeon, they were on vacation or something, and we had their time slot that day. So he tells me, you're going to go in for surgery at noon. So I had no idea I was going to have surgery that day. Calling my professors, my boss, like, hey, I got to get this cancer thing removed. Can you give me a little bit of leeway? I had a medical school interview that was going to be the day after. I'm like, hey, I got this tumor I got to deal with. Can we reschedule the next week? The doctor says I'll be loopy on the anesthesia. Can't do it now. So get the tumor removed. Procedure was all fine. I'm with the catheter bag for 3 days, at home. And then where I'm from, gets hit with Hurricane Helene, or the remnants of it, and we're without power. So I'm sitting here with my catheter bag and a flashlight trying to do my homework for engineering, because those professors, they don't give you a ton of leniency. And, I'm just trying to make it through the hurricane, healing from the procedure, the TURBT, and just getting on with things. So, I have the procedure, and then, 5 days later, we finally get power back. I'm finally back into college. The pathology report comes back that it's high grade, so we didn't expect that. I thought it was going to be low grade. So it was high grade, but we caught it in the earliest stage, TA, which is non-invasive. So it's just that outer lining. It kind of grows like cauliflower towards the space in the bladder that urine goes into. And with it being high grade, that meant we got to be a little more diligent. It means it looks funnier. It looks more aggressive, right? It hasn't invaded, but it looks aggressive. We have to do a re-TURP. We want to re-resect the scar in the same place we just resected it. Make sure there's nothing left, or if there's anything left, it's just that stage TA. So we do that, and luckily that procedure goes well. They did a blue light cystoscopy, which allows them to look for this other type of form of bladder cancer you can get called CIS, which is a lot harder to see because it's flat. Mine was kind of growing like a cauliflower, right? There's another type that grows flat, like a little single layer cells. And we do blue light, and we don't find any of that. He re-resects the scar, we find nothing. We do that, that was 6 weeks after the first TURP. and then I recover from that, and then it's BCG. After another 6 weeks, I started BCG. And BCG, it's an immunotherapy. It's the first few times you get it, it's like nothing. It's like them just putting water into your bladder. Then it kind of starts, you start noticing it, and then it just hits like a truck because I got to do a year of this stuff. And I would call it. I had my BCG on Fridays. I would call them Fire Bladder Fridays. So with BCG, I did them on Fridays because, I was a full-time student. I was trying to get through chemical engineering. I got meetings, I got labs. This is senior year of college at this point. I've got to design a whole chemical plant with my group if I want to get my degree. I've got all these medical school interviews. Like I have to have my week open. So, the BCG, it kind of knocks me out for 3 days. People react differently to it. But for me, it's very localized, very intense. So in the bladder, imagine like a really bad UTI, I think is the best way people can think of it. And I'd do that. I had three once a week, so a cycle was three weeks, and then you would have 3 months off. We would do a cystoscopy. They'd go in with the scope, look at the bladder, say everything's good, and then we would do it again. So I did that a total of 15 treatments. And sometimes you'd be fine after that third day for a few hours, and then later you'd have a bladder spasm. So I had to manage that. I there were times I had to stay inside. I was like, look, I can't do anything on Fridays. I can't do anything on these Saturdays, these Sundays. I need to be within 20 feet of a bathroom. Some of that pain, some of that urge, it was pretty rough. But I got through it. At first, there's everything seems normal. I got this blood in my urine. It doesn't hurt. I feel fine. I can still go on my runs, do my bike rides, whatever. And then it just kind of hit a little bit like a truck. I had to reevaluate my priorities. My mental health was on the back seat, trying to get through engineering and doing this pre-med stuff. Like, let's move that up. Let's work less hours in the lab. So I stopped that. Let's focus on treatment. I reached out to, for both medical school and undergrad, I reached out to the coordinator. I was like, hey, I need a accommodation that just says I can use the bathroom essentially whenever I need to during a test or whenever. I got to be able to go when I need to go. When I was on those BCG cycles, the good thing about being so busy was that I didn't have as much time to dwell on some of those negative thoughts. I think for me, it was just focus on the day. Before, it was really focused on getting through the day. Now it's kind of a focus on enjoying the day, making the most of it. So not letting a bad day prevent me from doing something I enjoy, because after the diagnosis, my time was just so much more appreciated by me. And making sure I use that in a way that I enjoy. That's my time's spent for me, and not dancing through some hoop to do X, Y, Z. And then now from this point, we've graduated on to regular cystoscopies. So we're looking at once every 3 months. Eventually, we're going to move to once every 6 months. And I have Scanxiety, having to go in initially every 3 months. I think now we're every 4 months. Soon it'll be 6 months. I mean, that's a lot. And then having the MRIs too. It's like, are they going to find something? What's it going to be? I think for me, some people have the kind of the mindset, like there's the whole like the fight mindset that I'm just only going to think positive thoughts. I'm going to fight this. Everything's going to go how I want, and that really just isn't how that doesn't really resonate for me. I mean, people will say that to me, like, "Oh, you're young. It's early stage. It's all fine," but that's not really something I have control over. If somebody is fighting all they can, listening to their doctor, doing all these things, going through all these intensive treatments, and they still have a recurrence or progression, does that mean they lost? I mean, that's why I don't like that mindset. I think the battle that we can fight, and the battle I fought, and the battle I feel like I've won, is accepting the uncertainty with these scans. So, being able to say, hey, I've got a scan coming up in a day. I'm really nervous about it. I'm still going to go on a bike ride today. I want to go on a bike ride. I'm still going to do that. Even after that scan, I had one. I was taking a golf class. My end of senior year, I had a cystoscopy. I was like, if they see something, if they don't see something, I'm going to golf, and we're going to go play around a golf after this. No matter what, I'm not going to let that stop me from doing what I enjoy and can do today. And one of the first things I found after I was diagnosed was BCAN. It's the Bladder Cancer Advisory Network, bcan.org. They're an absolutely wonderful resource. They have all these stories written by bladder cancer survivors, and that was something that really, really helped me get through those first few days. Was reading some of those stories from other people, and there's even stories from young people on there too, because it's global. It's everybody. And I was actually able to get connected through. They have a survivor to survivor program to another young man who was diagnosed with bladder cancer. He was 20 when he was diagnosed. I was 21 when I was diagnosed. He had the same diagnosis, high grade TA, and he had to do the BCG too. It was really great because he and I were able to have a phone call and talk to each other. And he's like, hey, yeah, I'm getting my master's now. This was 5 years ago. I'm living life, well to my best, and having him being able to mentor me through that experience was really great. I think if people can find somebody who's was in a similar position that they're in to help them be guided through that process is a really, really amazing thing. A lot better to have somebody like that than to just Google all these things on the internet, trying to use AI to tell you your prognosis, things like that. All these things you look up, they'll spook you out. But where you should really be, I think, for somebody who's newly diagnosed, be focusing their efforts. What should I be looking at? Because I want to think about this. This is something I got to process. Go to those organizations that have people who have been through it, and reach out for support. They will be more than willing to support you, and you're not a burden at all. I've found a way to manage this diagnosis, still do the things I love to do, and I got my degree, graduated summa cum laude on chemical engineering, and I went on to medical school. So I was able to keep my life intact, find that new normal, and just keep the wheels spinning. I'm a medical student, starting my second year of medical school. And of course, this diagnosis happening during the junior and senior years of college, that's kind of a very formative time. A lot of young people are figuring out their professional identities, what they want to do with their career. And it's a big decision. And the experience has driven my interest towards, after finishing medical school, pursuing urologic oncology as a career. For me, it was a really, really isolating experience, having sitting on my bed, nobody around me, finding out I have cancer. Nobody called me. I had to call them. That's just how medical records are released. Being a young person, I knew bladder cancer was a thing, but I don't think most young people do. If I can kind of sense somebody's going through something like that as a patient, and being able to, selectively, tell people, when it's appropriate, like, hey, I've been in your seat too, I think it's a really powerful thing that can help them cope in some of those early days, and also gained a lot more appreciation of my health and my future through the experience. Right now, before, health was just on the backseat for me, and now it's the most important thing. Everything comes second to that. You can't have anything if you don't have your health. So you got to start with that. You're prioritizing your mental health. I would tell myself, this is a big moment. Yes, you can cry. Yes, tell people who love and support you that, you got this big thing going on and you're scared about it. And it's okay to express all those feelings. It's okay to get those accommodations you need, and know that, it's not your fault. It's not anything you did. Your life's going to go on. You're going to adapt to it. You do find that new normal, and that normal changes a lot, and you get used to that change. You learn how to adapt to having to adapt, and it's something you can manage. Whatever the outcome is, you're gonna be there every step of the way. You're gonna have your loved ones with you every step of the way. You're gonna get through it. You're gonna get through it.